accidents can happen anywhere and everywhere, even out here in the wide open sea. So what happens when there is a casualty that requires evacuation? Well, with the powers combined of a medical squadron and a helicopter squadron, help is fast on the way. Once the alarm sounds, this team has 15 minutes to gear up and take off in this special red and white search and rescue Super Puma. The team comprises 2 pilots, 1 medical officer, 1 medic and 2 aircrew specialists. Their mission? To save lives.
My role in a SAR operation is trying to locate the survivor and rescue him and bring him to the medical facility in the shortest possible time.
My role is as a medical officer on board a search and rescue flight, and my responsibility is to provide medical care for patients or casualties that we pick up during the mission.
And there's an adrenaline rush in all of us, and I will try to keep calm and focused so that we can think through all the scenarios.
And in my mind, I'll be thinking about the diagnosis of the patient and what I should do on board the helicopter while bringing the patient back from scene to the hospital.
This red and white helicopter is much more than just an ambulance that can fly. It must be able to carry out the rescue operation safely. In an ideal situation, the Super Puma would be able to land on the ground to pick up the casualty. But in reality, there are many locations where it is not possible to do so, such as out here in the open sea. Helicopter medical evacuation, what happens is the winchman will be lowered into the water to rescue the casualty from the water to lift him up onto the chopper. This process is known as a winching operation. For such a tricky operation, the aircrew specialists have to perform the challenging task of rescuing the survivor from the sea.
My job in SAR operation is to operate as a winch operator and is to advise the pilot when conducting the operation to ensure that it is successfully carried out and safely.
Third Warrant Officer Tay's job requires him to lower his fellow winchmen into the water to bring up the survivor safely. It is not as easy as it looks, as the winchman has to brave the strong winds and there is much coordination to be done with the pilots.
Once we are stable overhead the designated point when we rescue the survivor, they are the one battering the aircraft, maintaining the aircraft in a steady position.
Once the survivor is on board, the helicopter will speed towards a hospital. En route, the medical officer and medic provide emergency aid.
And when they're on board, we give them some medical treatment in the form of fluids because they are dehydrated and monitor their vital signs on the way back.
And to do so, Captain Feng has to work with his medic. The catch, however, is that with the noise of all the engines, all communication has to be done via hand signals. For this special group of people, saving lives is all in a day's work.
I feel very proud of my job. The feeling is undescribable when the survivor we have rescued survived and is recuperating well in the medical facility.
I'm really proud to be doing this in my 2 years as an NSF, and also it's a meaningful and exciting job to save life, and not many people can do this.